Betsy, are you there? This is Mary Margaret. Or somebody there?
This is Justin from House Meeting.
Justin, I'm trying to figure out, what was I trying to figure out?
Gallery view.
Trying to put up a gallery view. Do you do that for me, or do I do that?
No, that would be top right.
Do you know, Justin? Are you there?
Should be at the top right-hand corner of your screen.
I can't hear him.
Justin, we can't hear you.
Are you talking to me, Justin?
I'll be right back.
Justin, I can't hear you if you're trying to talk to me.
Can you hear me now?
No, I can't. You got to speak up, or let me see if I can. I don't see my sound thing here. Is it your sound thing or my sound thing?
You can escape, hit exit full screen for now. Let's see. Do you have a volume thing around here?
Here's this sometimes.
So you can turn that all the way up.
Okay, try again, Justin. See if I can hear you.
And then click on it.
Where?
So I just click yours.
Can you hear me now?
I can hear you. That's better.
Double click.
I don't know
Let me
what you're
try.
talking
Let me
about.
try. That should work better.
Okay, I see. I cannot start screen share while other participant is sharing. You hear me now, Justin?
I can hear you. I can stop sharing if you're ready to begin.
Well, no, I'm not. I've got a few minutes. I just want to see. It looks like that Sally is on. Is that correct? Hello, Sally. There's a picture.
Hey there,
Okay.
I'm here.
You're a little bit soft. I'm not sure if you control your volume or I do, or Justin does.
I can keep talking a minute.
Yeah, that's a little better. I just want people to be able to hear each other.
Okay, I can talk up.
How are you today?
I'm doing good. How are you?
Struggling today.
Uh-oh.
It's July in Georgia, which is a big problem for me.
It is definitely hot enough.
I began the week with 2 political parades, and that just is a chore in the 100-degree temperature.
Oh my goodness. Oh, no.
Where do you live, Sally?
In Macon. I actually live in Bolingbrook, which is outside of Macon.
I was in Macon a week or so ago on the Camulgee River at Dick Cresswell's cabin. He's with the law school, and he's always been generous to let us use his cabin. I'm on the Altamaha Riverkeeper board, so I'm following closely all the new national park stuff that y'all are excited about.
Yeah. Yeah, I have some friends that have a cabin up there as well. They actually have a whole little area. Is that in the Juliet area where
It's
they
in
are?
Juliet, yeah.
Yeah, yeah. There's a camp up there that I have a friend at that she runs it.
There's a lot of river access up there. Georgia Power has an access just above Dick's cabin. He's had his cabin forever. There's just a lot of good use of the Ocmulgee. So I'm very happy about that national park.
Yeah, definitely.
Are you on, Holly? Were you able to
am.
solve your problem?
I was.
Okay.
I'm going to keep my mute on and listen over your shoulder unless I'm talking, because I think there might be an echo.
Okay.
And if I have to go out in the hallway for my part, I'll just do that.
Or you can have my seat when we talk about yours.
Okay.
And Justin, we're still early. It's not time to turn on. I just want to make sure everybody can hear each other.
No problem.
We did it. We made it.
I'm looking as to who I expect. I expect more than names are on my screen right now. Nicoletta said she's joining us.
Yeah, Brittany's on our team. They sent it out to the commission. The Zoom went to the whole commission in case they wanted to join and have questions. Which I can try and monitor those questions in the chat.
Okay, thank you. Well, the Georgia State people are going to join us. I think we're only waiting on Cindy Levi.
There's Leanna Greenwood or Green something. And Chet. So we got the healthcare workforce folks.
Polly, I've got some Cokes in there or water if you want one.
I'm
Diet Coke.
now. Thank you. I just haven't looked what's water there.
Would you write down that internet connection again so I can once more put it on my
Yes, sir.
screen? Justin, I have 302. Can you hear me?
I can. I'll stop sharing.
Okay, I can barely hear you. Is it possible for you to open all the windows now and let's see each other? Whoever wants to be seen. And it's totally up to y'all.
I'll be seeing in a minute.
I guess we don't look that great. I don't look that great, so I need to put sure.
Yeah, well, we appreciate your time. We really do. The only person I think I'm waiting on right now is Cindy Levy and perhaps one of the There's Cindy right there. Good. And
Yes, hi.
perhaps one of the Georgia State people. So I'm going to go ahead and start if that's all right with you. Can everybody, if everybody can hear me, I'm assuming, just give me a thumbs up. Great. Thank you very much. I'm Mary Margaret Oliver. I was appointed by Kevin Tanner to chair the Workforce and Systems Development Subcommittee. And Kevin and I have talked a good bit about that job. And I'm going to talk a little bit about the work that we've been doing since the passage of 1013. And then we'll go into a discussion of the systems database that is one of our duties. But before I do that, because Zoom, we don't, for me, I'm speaking for myself right now, I miss opportunities to really know who I'm talking to. So Leanna Greenwood, let's start with you. Who are you and why are you on this conversation with some other smart people?
Hi, I'm Leanna Greenwood. I'm the Senior Data Analyst at the Georgia Board of Healthcare Workforce.
Thank you very much. How long have you been there?
A little over 3 years.
Good. So you've got a little history with these issues we're talking about. Thank you. Sally, where are you today?
I'm actually at home today, but
Good. Good.
I'm from Georgia College and State University. I'm a professor of nursing. Now I have the state's HRSA A New grant, which is focused on providing advanced nurse practitioners into the rural and medically underserved areas of Georgia, including psych mental health nurse practitioners.
It sounded like you used the word HRSA grant, and I wasn't quite sure I understood. What word was that?
HRSA, the federal HRSA government.
HERSA stands for?
HRSA. HRSA, let's see, what does that stand for?
Is it a federal agency?
Yes, it is.
Okay.
Healthcare Resources and Services Administration, HRSA.
I tell people all the time, when somebody uses initials, I'm immediately thinking, what that means? And so I missed what you say after that. So it's a federal agency.
It's a federal grant that helps support students. And we actually partnered with the Department of Public Health to be able to send some of their nurses back to become nurse practitioners.
That's great. That's great.
Yeah, it's been really great. We've had it for about 6 years now.
And have you been on the Workforce Study Committee the last couple of years?
Yes, I have.
Good. Nicoletta, I know you're with Georgia Tech, and Kevin Tanner tells me that I need to go see you, sit down with you, and you explain to me what you do and why it's so helpful to our discussions. So what do you do?
I do research with lots of data. And my main focus is on healthcare access. And actually, I'm working right now to finish a paper. We're looking at really thorough healthcare access to mental health in Georgia. So hopefully I'm going to have that soon out. Primarily, actually, we're looking at Medicaid because we have, and we're including care from school, from home. So we're going to have some numbers soon and to identify where the gaps are, what are the communities where we need to intervene, whether it's throughout the entire Georgia. That's always, that's what my expectation is, to see the need to improve access throughout the Georgia. But I use a lot of data. I'm pretty good with data. I have a large team of students, postdocs, and we've talked 2 years ago or so when we started this commission, we talked about various ways we can integrate data with portals that could help the state.
What school at Georgia Tech are you with?
Industrial and System Engineering.
Okay. And what I'd like you to do is to send me all your contact information with just sort of what school you're in and that kind of thing. And Sally, that'd be helpful for me too, just to kind of place you when I see you. The next person, Cindy, are you on the line with us? Cindy Levi?
Yes, I am on the line with you. I'm actually in a hospital. My mother just had a surgical procedure.
How's
so I'm
she
trying
doing?
to juggle several things.
Do you need to go? Because we won't keep
No,
it. That's more important.
Fine. She's fine. Thank you. So I am the CEO of Avita Community Partners, one of the community service boards. As I'm sure all of you know,
Whoops.
community service boards are behavioral health and developmental disability services across the state of Georgia. I have been with the workforce committee since its inception. Obviously, we have a genuine interest in the workforce of providing mental health services.
You also are the CSB that's worked with Forsyth on their co-responder program for the last, I guess, whole year. And we
Yes.
may talk about that in some other context, because that's really an important new program that's being initiated. I talked to Wayne Senfeld. I've left messages, we've emailed back and forth, and he's not available today. He's with Tanner Healthcare over in West Georgia, and I have an appointment with him to meet with him a little bit later. Anybody else on the call right now who's a committee member that I do not want to overlook? Okay, let me begin with giving you a little bit of a summary of 1013 during the General Assembly, and more importantly, what's happened after the session and the charges we're marching forward on. Did any of you have a chance to go down to the Capitol during any of the times, the 10 hearings we have? It was,
This is Cindy.
yeah.
I was at several of them, yes.
I've been involved in lots of different legislative actions, and I will tell you this was very unique in many different ways. It was unique and positive. All of these uniquenesses, or almost all, were positive influence. And I credit Kevin Tanner and David Ralston. David Ralston used the power of his office in a very strategic way. And let me just summarize that, because I think it's helpful for those of us that are kind of in the political world to see a successful effort and to comment on it and to recognize what was successful. He and Kevin Tanner, at some point after the 2021 session, when 2 bills were passed based on the recommendation of the Behavioral Health Commission, had a conversation about moving forward on the remaining recommendations. And that conversation resulted in Kevin Tanner being continuing as chair of the commission, even though he's not longer a member of the General Assembly, and really being the engine behind an enormous amount of work. Strategically, and this was very impressive to me, the speaker made an announcement in summer of 2021 that he was going to go forward with major reform on mental health. And simultaneously, he was speaking to a law enforcement office crowd conference down on the beach. Simultaneously, he said, I'm going to create, mandate, provide $75 million as monies to assist law enforcement on the issues that face them every day, including mental illness. So at each step of the process, the speaker said, this is important to me. We're going to make sure it's funded. And Kevin Tanner brought me into the picture and about a half dozen other people in May 2021. And we began working on it seriously. By the fall of 2021, we had a draft of a bill that came from all the different subcommittees, including obviously the Workforce Subcommittee. And we began vetting that bill, and with agency heads and with advocate groups. And there was a core of advocates, I'd say at least a half dozen, who were with us every step of the way. We were making a whole lot of progress, and at each time strategically, the speaker would talk publicly, this is something I care about. And he always said, this was another strategic decision he made that I think was helpful. He said, this is going to be a bipartisan effort. And he meant it. And throughout the summer process, I was a little bit, I was always in the picture, but when he talked about bipartisanship, I think he was kind of pointing at me, but that didn't become official in any way until after we had a bill ready for introduction. And he, again, was the point person. He, again, was the person who said, this is my bill. And I'm appointing Todd Jones and Mary Margaret, and it's going to be funded. It's going to be bipartisan, and this is what I care about. And if you look at just political messaging, he did everything right. He was consistent. He was carried through with what he said, and he talked about it personally. And I believe he felt it personally. It was interesting to me, some of you may have seen this, his public statements, he always gave his wife credit. Cherie always gave her credit, and he always quoted her as saying, "You need to help some people." And I thought the way he said that was very charming, and she's always been with him, which is really lovely to see. They're clearly a partnership. So we had 10 hearings during the General Assembly, and we had about 100 amendments that came in. And that was a very positive, from my perspective, not 100% positive, but it was a positive legislative effort where Todd and I and Betsy Howerton and advocates group, we were all meeting every day, all day. And the bill became stronger and stronger and stronger. Turning to the workforce issues, which I want to talk about from now on, we had, Todd and I agreed from the get-go that our priorities for the bill were parity, mandating 85% of MLR, and workforce. Those were our top 3 priorities. The rest of the bill was clearly important, and we worked on the rest of the bill, but when we were in the back room, we always kind of shared notes on what's important. The parity discussion was the most difficult and the most, not contentious, but it was the most difficult in terms of substance and in terms of engagement, but we successfully reached a resolution. The MLR 85% was a little bit contentious, but they never really opposed that in public. And when I met with Kaylee Noggle, the director of Medicaid, a week or 2 ago, she says in their new bid process, they're going to require 86%. So that was all positive. The workforce part of the bill, which is going to get our attention, actually was never much contested. I never had anybody, did any of you ever hear anything, we don't want this $10 million of cancelable educational loans spent? I never heard that from anybody, which was very exciting. I mean, when you put a bill out, you never know what's going to happen. At some point, relatively late in the process of the 10 hearings, Lynn Riley came to us. She's head of student finance, and she had 3 pages of amendments. And Todd, God bless him, went off with her and incorporated what she needed, not so much everything she wanted, but we reached a compromise with her on the educational loans. There's one issue there that we're still working on. That's why we're not talking about it today, but we will, the next meeting or 2. Lynn Riley, I think for correct purposes, I understand exactly what she's saying. She wants to make sure that this particular educational loan forgiveness program is consistent with others. And let me give you an example, and I'll ask any of you who know the answer to this. How many of the other healthcare graduate degrees that are cancelable loans are dependent on a person accepting Medicaid? Sally, do you know the answer to that?
I do not. And that is a very good question. And I don't know if it's even in the legislation. Like there's been, which was one of my sticky points, was the 10,000 was all they were offering for the advanced practice. I don't even think it was in that legislation.
It came in and out in our bill.
Okay.
It came in and out. And that's one of the issues that we're talking about, because that's a consistency issue. If you're going to require this group of medical providers to get their loans forgiven to take Medicaid, but not this group, that's the kind of thing that's a smart question to ask. And so we're working on that. But I was very pleased, delighted that nobody really opposed the whole concept, because every single person who came forward, regardless of who they were representing, said we have workforce issues. And this is something that will take time, and we're going to make, we're going to go aggressively with it, but it's going to take time, and we're going to have to measure it. Sally, do you have any opinion, or anybody have any opinion on whether cancelable loan programs are effective to send people to underserved areas?
I do. I think they're very effective. If they're done, and I know that that was one way we kind of set ours up. We gave them to the people that came from the communities
Mhm.
that they could go back into. They wanted to stay where they were. And that was one of the things working with the Department of Public Health. We were using their nurses and they were the ones who had to, recommend it.
Mhm.
And most of them have stayed with the Department of Public Health.
That's what I'm
Salaries are an
interested in.
issue. Yeah.
Maybe since you're working in this area, you could send me something that would be helpful for me or simple for me. This is the kind of research that we've done on whether educational loans are effective to send people to
Yes.
underserved area. And
Yes.
these are the elements that made them successful or not. Nicoletta, do you have an opinion about that?
Actually, I did an analysis, a paper a while back on the impact of adding providers for oral health and then obviously you can see because they actually come in areas that are underserved, and then so the impact is much greater. So we've seen that rather than actually increasing the workforce, is actually, we call it in my field, targeted interventions, right? You target, the loans are targeted because they address the areas where we have the highest unmet need.
I anticipate that I and Kevin and some group of us, not in a subcommittee meeting, but in some other kind of meeting, are really going to talk to Lynn Riley in some detail. And I would like to go, when I go to her, see what are the issues of consistency that you think are important, Lynn, and what are the issues that you think are provably effective. For instance, this went back and forth too. Do you have to be a Georgia resident to get a cancelable loan? I mean, could the loan come from the Rollins School of Public Health? And that's something, those are just issues that I want to understand fully and see what is helpful. Somebody in Maryland who went to Johns Hopkins, are they eligible? And I don't think we're consistent about that. Sally, do you think we're consistent?
And I think it would depend on how the particular, what wording was in it.
Yeah.
I know for mine, I made sure it was Georgia resident.
Mhm.
And that was very specific, but I wrote that in to the grant to make sure it was still coming from Georgia. But now I could see where somebody was living on the line between, Alabama and Georgia or South Carolina. You would expect, if they're right on the border, why would you say no? But
right.
At the same time, you don't want them leaving.
And why would you not require somebody to take Medicaid if you're sending them to Southwest Georgia? They're going to have to economically, but I mean, I'm just curious about that. And so anyway, there's some good discussions that I anticipate we'll be having. And to the extent you can convince me that there are various issues that make these loan cancelable programs more effective, that'd be helpful to me. And then we'll talk about what might be a negotiation with Lynn Riley and her experts on how we proceed. What is her power to define this, and what is the General Assembly's power? All of that's almost always part of our discussions. So we'll be coming back to that. Anybody else want to say anything about the loan cancelable program, which we'll be talking about further before we go into the database issues? Okay, I have, y'all may know this already, but the minimum data set survey issue that is in the bill under the Workforce Part 2 section was brought to us by a number of different people, but Voices that was kind of one of their primary issues as we moved forward in the 10 hearings. Again, and that was an issue in the Workforce Development Part 2 of the bill that never got a lot of discussion. But I think it might be helpful before we hear from the Judge Board of Healthcare Workforce that has a new duty under the bill, if we could hear from Polly, who's here in my office. She came just because it was logistically work. And there's Polly on camera. Polly, walk us through what you think the history of this issue is and why it's important to be in the bill. And I'm going to give you my seat.
Okay. We have audio challenges here. Do the dance. Oops. Hi, everybody. I'm Polly McKinney. I'm the Advocacy Director of Voices for Georgia's Children, and I'm going to, we have a short slide deck with a little bit more text. It's just to talk about the history of the Minimum Data Set Survey, which is now artfully called the Behavioral Healthcare Workforce Database. Thanks there, House Media. And I'm just going to read our Research and Policy Director, Melissa Haberlin DeWolf, actually, and her team, Brittany's on this call and Maria's on the call as well to help us prepare this presentation. So I'm going to pay them the honor of reading it the way they wrote it, because I'm sure it will be accurate the way they wrote it. But if you have any questions, go ahead and put them in the chat, and we will monitor that chat and come back and answer questions at the end. Basically, I'm going to provide a brief background on how the Behavioral Healthcare Workforce Database came to be. I'm just going to call it the database from here on out, everyone, because it's a lot of words. Georgia's made significant investments in programs and supports to improve available behavioral health services. Much of the progress made can be attributed to working within a robust organizational framework called the system of care. I'll start by describing the system of care, Georgia's system of care, and then provide a bit of historical context as to how the framework has fostered collaboration among agencies, legislators, and community organizations to develop and implement a system of care plan. And lastly, I'll highlight how the implementation of the database is a natural next step in the plan. And we can hop on over to that next slide, please. Thank you. The system of care framework for service delivery strives to create a spectrum, you can see the little circle there on the right, of effective community-based services and supports for children and youth who with or at risk for mental health or other challenges and their families. This is organized into a coordinated network, builds meaningful partnerships with families and youth, and addresses their cultural and linguistic needs in order to help them function better at home, in school, in the community, and throughout life. And that's a direct quote from the System of Care document. Established in 2009 by the Georgia General Assembly and the Behavioral Health Coordinating Council, this supports Georgia's behavioral health serving agencies and partners. The Behavioral Health Coordinating Council acronym, Representative Oliver, is BHCC.
And who's the chair of that?
I believe, Brittany, correct me if I'm wrong, but I believe Judy Fitzgerald, the Commissioner of Behavioral Health, is the chair. The BHCC establishes goals and recommends measures for improved efficiency and access to services. The purpose and mission of the council is to identify overlapping services regarding funding and policy issues in the behavioral health system, and that's the whole big system. The interagency directors team, which is the one right in the middle of your slide there, was created by Georgia's Department of Behavioral Health in order to design, manage, facilitate, and implement an integrated approach to child and adolescent system of care that informs policy and practice and shares resources and funding. We call that the IDT. The IDT is made up of over 20 representatives from state agencies and non-governmental organizations that serve children with behavioral health needs. In that, the kind of organizations, in addition to an array of state agencies, and this is me ad-libbing here, include the Carter Center of Voices for Georgia's Children, Resilient Georgia. I mean, it's an array of people in the IDT who have been working together very effectively for quite a few years. The local interagency planning team, which is what I'm going to talk about next, the purpose of it is to provide and facilitate the coordination of services for children living with severe behavioral health needs or addictive diseases. That acronym is LIPT. The LIPT would focus on assuring the following: that children have access to a coordinated system of supports and services in their area. A variety of therapeutic and placement services are available in the community. Fragmentation and duplication of services is limited in order to maximize the potential for children to receive the best care for their needs, and to support effective referral and screening systems so children have access to appropriate and meaningful care.
The LIPT collaboratives, which is, if you look at the green triangle, the second one up from the bottom is the collaborative, and that works between the LIPTs and the IDT. And they have the collaborative has two main functions: to create a feedback loop between the IDT and the LIPTs, to increase awareness and inform regional trends and issues, and to provide a regional opportunity for collaborative learning and service coordination. The Georgia system of care is premised on foundational building blocks: coordinated network, family and youth voice, culturally responsive care. These building blocks are prioritized throughout the community partners and/or state agencies within the network. And the goal for these partners and agencies is to collaborate and support and serve communities with mental and behavioral health challenges. That we can move on to the next slide, which is actually the history. I don't know where that went on my papers here. And this is a history, and we'll make this PowerPoint available to everyone. But there's been quite a run in the last 30 years around this work. 1990, Department of Ed, the Georgia Department of Ed and the Department of Human Resources, which at the time housed the Department of Behavioral Health, among a bunch of other things. They were directed to craft a system of care plan, 5-year one, to better serve children with emotional disturbances. Now that was in statute, and they drafted their first plan. The local interagency committees, now known as local interagency planning teams, the LIPTs, with representatives from each child serving state agency, were created to facilitate system of care at the local level. Then you bump on up to 2009 and you see DBHDD, the Department of Behavioral Health and Developmental Disabilities, was created. And under them, the Behavioral Health Coordinating Council was created. The next year, the IDT was created, the Interagencies Directors Team. The year after that, DBHDD created updated a 5-year system of care plan. They drafted that. And then it was a good, 6 years later, there was a new 3-year system of care state plan created by the IDT and BHCC. And that's when Voices for Georgia's Children, the organization I work for, so we started recommending the minimum data set survey, which is now called the Behavioral Health Care Workforce Database. That was adopted into the state plan in 2017. And there were a lot of people looking for this. It wasn't just Voices, but we got to do the slides, so we put our name in there. 2 years later, the Behavioral Health Reform and Innovation Commission was created. And a year after that, the IDT updated their comprehensive 3-year system of care plan. Then the Behavioral Health Reform Commission released its report, including a recommendation for the database. And then, of course, as we all know, 2022 it passed. So that's the basic history of the database and how we got to this point. Now, the last slide, if you can ping over there, this is just how the oversight works for this. So the provider would complete the survey for licensure. The licensing boards collects the data. Since licensing boards under the Secretary of State, they monitor and implement the data, and then the Board of Healthcare Workforce evaluates the data. And we have people on here who know a lot more about that, who are about to present after me, so I'm not going to say much there. And then there's your public access. Now I don't know if this includes that last slide. Is there one more slide? House media? Yes, so we threw this in here. I'm not going to talk too long about this, but this will be in the deck. Brittany and Melissa and their team did a lot of research about what kind of questions would be asked in the survey, and we've put them here in sort of some broad categories. The things that are in bold are currently mandated by law in the Mental Health Parity Act. The other stuff are things that we found in other similar surveys across the country, and we can talk more about that in some other platform at a later time. But that's it. That's my things. If you have any questions, again, put them in the chat, and I'll try and answer them.
Thank you.
And thanks. Yes.
Thank you, Polly. There are a couple of reasons I wanted to go through that. when we came to the table, the commission members came to the table and started drilling down, we found a number of different legislative duties that had been created at different times with assignments to different agencies. And what that creates is, and I'll give the example that I always give, the prescription formulary, develop a prescription formulary for payment of prescriptions, was assigned to 3 different places in 3 different statutes. And with that example and with some others, we tried to consolidate the real work into one entity that would be responsible. The Behavioral Health Council, created by statute, chaired by Judy Fitzgerald, and the Behavioral Health Reform and Innovation Commission, chaired by Kevin Tanner, and Grant Thomas, the governor's Health Strategies Commission, are the 3 different entities right now that share an awful lot of work. And one of the things that I've been conscious of, the legislative crowd's been conscious of, is trying to, and we did some steps in this, to make this a little bit less everybody's on deck with, say, this person is responsible and this person has a deadline. I told Grant Thomas, the head of the governor's interagency for healthcare strategy, that we were giving him a lot of new duties, and we were going to be looking January 1st, 2023 for how he did it, so there's some good and bad news to all this. But I thought the history that statutorily we've been looking for a database of some kind has existed for a while. In terms of our format, I'll come back to this. I've asked House Research to set up our logistics because they can stream and because they do a transcript of our hearings. And it's available to you. You can have it with captions if you like. And there's a way for you to do that on your computer. We also are going to be translating some of our hearings because we're moving towards everything being more accessible to a variety of people. I wanted to put that in there. And if any of you have any suggestions on exactly how we can use these Zoom meetings more effectively and when you want to meet in person, which we'll do at some point, please share your thoughts with me. I'd like to hear what your preferences are. Before we get to a kind of a general discussion about anything, I want to call on now the Georgia Board of Healthcare Workforce and how are they going to do this that we have put in statute for them. Mr. Basson, would you like me to start with you, or who in your group would you like to start with? What's convenient for you?
Hello, can you see and hear me?
I can see and hear you. Can everybody else see and hear you?
Yes.
Oh.
For the group, Mr. Basson started a week ago or 10 days ago.
That is
And
correct.
welcome to our work. And thank you at a very early time of your service for Georgia for agreeing to stay with us, jump in with us. And why don't you tell us a little bit about yourself, if you would, please.
Absolutely, and thank you for having not just myself, but the rest of us from the team here. High level background, I've been with the organization or the Healthcare Workforce Board, like you said, for about 2 weeks. Prior to that, I've spent the majority of my career in hospital administration and running physician groups. Been in for-profit and not-for-profit healthcare. A lot of my time has been spent as CEO, administrator, chief operating officer, and/or chief strategy officer of such entities. Most recently, I was here in Atlanta with Shepherd Center as the chief operating officer and then the chief strategy officer. And then my role prior to coming to the Healthcare Workforce Board is I ran a investor-backed company that staffed nurse practitioners and physicians in Florida, Georgia, Alabama, Louisiana, Mississippi, New York, and was working on some deals in Nebraska and Iowa, but that was investor backed. So the goal was high growth. And I'm glad now to be here at the Healthcare Workforce Board.
I would be grateful if you'd send me your resume. I'm very interested in it. So you've been in Georgia working at Shepherd, which is a big star in our healthcare systems across Georgia. How long were you at Shepherd?
I was there for 4 years.
Thank you for taking on this job. And for the rest of you, you may be aware that there was a sudden death of the former executive director, and they've had an interim director for a while. So it's been tough. And this is a big new job from our perspective. So tell me what you'd like to tell us about how you're going to do it and to what extent you need our help.
Absolutely. What I'll do is I'll just give you an overview of what's been done so far and kind of the plan forward. And what's been done is I have reached out to, I get what is my peer at each of the different boards that is listed in HB 1013. And I've requested a meeting. Those invites have been sent out and everything is should be concluded by the end of this month. The goal is to educate them. I'm assuming they're aware of it, but just in case, going to educate them on this past legislature and then bring the group together collectively. I envision that'll happen in August. What I don't know at this point is, do each of them use the same or a different credentialing software in terms of when they get folks licensed in their respective boards? To the extent that they have the same, this could move quicker, but that's TBD, or we'll find that out. Excuse me. We also, Leanna, who's on the call, and she introduced herself earlier, did meet with the data analytics group, and they're going to obviously have some involvement in this. We don't know to what extent, but we have planted the seeds.
May I interrupt you? May I interrupt you? The data analytic group is not a very old agency. Where is it housed, and how do you see, what is their data set that overlaps with these tasks?
Well, I actually couldn't, I wish I could answer that question, but I can't. But we were thinking is, if there is information that's going to transfer, then let's at least involve them. There might not be, but I was just trying to think ahead and involve those who might need to be involved. But to your point, there might not be an involvement. And it, for me, also is probably selfishly done, since I'm new in the role, to kind of establish contact. Because sometimes that, as you know, sometimes that takes a minute to figure out who's who and get a hold of them. At least this week, I could fast track that in the future.
Thank you. Go ahead. I interrupted you. Sorry.
No worries. And then the last thing is, I did reach out to our contact at the AG office, just in case an MOU or something needed to be established between our organization and any of the licensure boards, just to make sure that we're doing everything properly. So we're moving as fast as we can, trying to lay the groundwork. But the good news is, I could say and sum it up, is the conversations have begun.
Thank you. One of my, is there anybody else you'd like to have anything to say, participate with us, Mr. Basson? How do you pronounce your name? Basson?
Basine,
excuse me. Anyone else in your group you'd like to offer up anything?
We do have three others. Leanna Greenwood, who already introduced herself, and then we have Freeman Montauk and Sherry Tucker. At a minimum, maybe if both of you wouldn't mind just turning on your camera and saying hello, and perhaps doing a brief introduction of your role with the Workforce Board.
Yeah, thank you. That'd be helpful.
Hello, can you hear me and see me?
Yes, sir. Yeah.
Hi. So I'm Freeman Montague. I was at the time the interim executive director after Ms. Hughes unexpectedly passed. I'm actually the budget manager. And so actually at the time, from about November until when Mr. Basine came on, I was kind of doing both roles during the legislative session. But yes, so I mainly just do the budget for the board. I've been trying to help Mr. Basine sort of onboard and transition to his new role as the permanent executive director.
Thank you. I'm going to ask you a question, and anybody can answer, because this is kind of one of my moving forward tasks. Mr. Freeman, you helped me a lot on setting this up, so thank you. Did anybody in your group follow Senate Bill 374 that was sponsored by Blake Tillery to do some amendments to the data analytics system about data sharing? That bill did not pass, but it got a lot of attention.
Yeah, I know, Sherry, you're on the call too. I don't recognize that Senate, you said 374. I don't recognize that number. Sherry, do you know if that, of that number, that Senate bill?
No, I do not recognize it either.
Okay, who was just speaking?
Sherry Tucker.
Okay. The reason I bring it up is that Kevin Tanner has asked me a couple of times to look at Senate Bill 374. So, and to see if it provides some assistance and guidance in relation to data sharing. One of the things, I'm moving away here from the database, that's a big deal that y'all are going to be working on. The data sharing issue is part of our, in Kevin Tanner's mind, and therefore it's in my mind, the Subcommittee on Workforce and System Development is our task. And the Senate has been a little bit more aggressive on the data analysis creation and with Senate Bill 374. So I'm going to put that on an agenda in the future. And I want everybody to, at your convenience, with all your time, give that bill a look and tell me to what extent it may relate to some data sharing issues that we're always struggling with.
I just put it in the chat.
Thank you. And thank you, Polly, for putting that out there so quick.
Polly
You
just put
share
it in the
that with
chat.
us too? Can you share the number again? I want to look it up too. It's a House.
It's a Senate Bill 374. And I think, Polly, you just put it in the chat.
Yes, ma'am.
Okay, thank you, appreciate it.
You know, y'all may know that if you've been in the Capitol a little bit, there's a competition between the House and the Senate that really exceeds the competition between Democrats and Republicans, or men and women, or black and white. I mean, there's just this kind of interesting, because I've served at both parties, both chambers, so I can say this freely. And so there's a number of things that the Senate was interested in that they were directing us to, and they're vice versa. But Senate Bill 374 may be a project for us to think about. I want to understand it. I want to know how far it got. It came through the House Judiciary Committee, but I don't remember it, because that's my bad. But I think that it's something that's a serious piece of legislation that we may have future discussions about. Let me move to the future right now. Thank you very much. Is it Mr. Basine or Dr. Basine?
Mr.
Mr. Basine, thank you very much for being with us. And
Sure.
we will be checking back with you. I know we will, and seeing how we go. And this survey questions, I don't know how many other, I don't know if the nurses, I'll use the nurses as an example, have a detailed survey question that goes into a database. I don't know if that's true, but I'm thinking that it's not true. I'm thinking that there's not consistency
There is
from all
not.
the different workforce. Is that accurate? Would you say that's accurate? Anybody want to answer that?
The Board of Nursing doesn't collect at this point,
Does or does not?
does not.
Okay. So that's a discussion we'll be having as we move forward. Is it best that we can collect it? The 1013 says we do to a certain extent. So we will be revisiting that discussion when we hear more from other nurses, doctors, PAs, nurse practitioners, mental health workers, how they feel about that. Let me stop and ask anyone, Nicoletta or Cindy or any of the committee members, if there's anything, Sally, anything you'd like to say or offer or follow up on this discussion. You'll be thinking about all this. You will be sending me whatever emails. My law office email is what I use 100% of the time, which you have on your stuff, but it's mmo@mmolaw.com. And tell me whether you prefer Zoom or prefer in person. And we will be meeting every month or two. I think we probably meet again in September. It's interesting to me, again, carrying forth this project intensively for the second year, the energy that Kevin Tanner is putting on this project. I think that's enormously positive because the speaker is very happy that he's doing that. And the effectiveness, it really is the beginning of a long discussion. The effectiveness of 1013, we all know, is going to be based on whether we implement it. I'm not telling you a secret that we pass a lot of things that we ignore. That's not a secret. And so this is an issue that the speaker cares about, and a good many of the legislators you know, one of the things that happened, and this is not surprising either, the number of people that came to me and Todd Jones, and we were the primary worker bees on this bill for beginning in January when it was introduced, and told us their family story. We know a lot about family stories that we think every family has on the tragedy of mental illness and the power of mental illness. So we're seriously getting to work on this, and I'm grateful for Kevin Tanner's leadership. What else have I forgotten? Nicoletta, you want me to talk about in any way?
No, just listening. I'm actually kind of typing in some information. I'm trying to look up chat, and because I think that's I would like to have a closer conversation with them to see what their plans are and how they're you know, what they're envisioned to have moving forward. Maybe
Well,
we have our monthly meetings. Yeah,
I certainly invite y'all to talk to each other. That's a really good idea. Sally, anything you want to offer? Anything you want me to do?
I think I'm good right now. I'm trying to wrap my head around everything.
Good. Well, somebody say hello to the dog. My dog usually barks during these things. So. Thank you all. Thank you all very much. Polly, anything else I've left out?
I don't think so.
Okay, thank you all very much. I appreciate your time. I do intend to limit our Zoom meetings to an hour in the future, and we'll talk about when we meet together. Thank you very much. Your only homework is look at 374 and tell me what you think. Bye.